The Midday Show, live on QBS.
Perinatal awareness. Now, funnily enough, we're touching on this topic ahead of Maternal Mental Health Awareness Week, which is from May 5th till the 11th, and I think this is a great time to talk about it. Qatar is at the forefront of integrating precision medicine into maternal and neonatal healthcare. PM utilizes biological, lifestyle, and environmental data to tailor medical care, including pharmacogenomics to optimize medicine therapies for pregnant women and neonates. Initiatives such as screening, such as premarital genetic screening and newborn screening, are part of Qatar's commitment to personalized care, aiming to improve health outcomes for mothers and infants. Now, I also did mention that Maternal Mental Health Awareness Week is held annually from the 5th of May till the 11th, and this week aims to raise awareness about maternal mental health issues and reduce stigma. The theme for 2025 is Your Voice, Your Strength. This theme focuses on advocating for all families affected by perinatal mental illness to access the information and support they need for recovery, particularly highlighting the importance of women feeling heard and supported in expressing their mental health needs during pregnancy, birth, and parenthood. And it's time we kick off our conversation with Dr. Bothina Al-Mullah. Now, today, like I said earlier, we're shedding light on perinatal wellness, a vital yet overlooked aspect of maternal health. We'll explore the emotional, physical, and mental challenges that expecting and new mothers face, and discuss how awareness and support can make a lasting impact for both parent and child. Our expert for the day is Dr. Bothina Al-Mullah, a Qatari OBGYN specializing in women's pelvic health and surgery at Hamad Medical Corporation. With a medical degree from Vail Cornell and a master's in healthcare management, she combines clinical expertise with a research background in reproductive medicine and maternal health. She's also dedicated to education, mentorship, community service, and has recently received the Scientific Excellence Award. Welcome to the show, Dr. Bothina. It's great to have you here.
Thank you so much, Juhara. I'm honored to be here with you in QBS Radio.
I was telling you off air, I'm very glad you made some time for us today. I hope your patients understand if they decide to listen to the radio. They're like, isn't that my doctor? Is this why she canceled my appointment?
I'm already receiving messages. We hear that you're on a QBS Radio.
Yeah, so I apologize to your patients that we're taking you away from them, but it's for a good cause.
Exactly.
It's for a very, very good cause. So getting straight into it, mental health during pregnancy isn't something that we hear about as much as physical health. Why do you think that is, and why is it so important to start the conversation?
Usually when we think about a pregnancy, the focus tends to be on the physical milestones, the ultrasound, blood test, seeing the baby on a 3D scans, but we kind of forget about the emotional well-being of the mother. And because there is a belief that pregnancy is all about joy and happiness and, welcoming a new baby to the family. But mental health is as crucial and critical as the physical well-being of a mother. According to the World Health Organization, WHO, about 10% of pregnant women during the pregnancy they go through depression during a pregnancy, and 13% go during depression during their postpartum period. And if there is a low-income setting, then the number will increase. It can reach up to 25% of the pregnant ladies having postpartum depression. So a mother's emotional state, it affects the health of the baby and the health of or her own health as well. And it will affect how she will take care of her baby, her family, and it also help them how the baby will develop and the milestone of the baby development will be. So it's very important to shed a light and on this topic and talk about it to educate women about how to deal with it.
New mothers, especially if it's their firstborn, tend to focus a lot on their child and they forget themselves. Right? I was telling you sometimes what we see from portrayal in television, and I think it's a reality for a lot of new mothers as well. You know, they forget themselves, they forget to shower, brush their hair, brush their teeth, because the focus is on this new human that's in their lives, that can't take care of themselves. And unfortunately, I think a lot of new mothers, when they get to that point of forgetting themselves, they receive harsh criticism that is unnecessary and completely unneeded. You know, it's a hard enough time without other people jumping in. And I think, you know, it's one of the things that adds, right, to their declining mental health. If they want to receive help, they're like, well, what would people think of me? Right? I can't take care of my own child.
Right.
So, yeah, it's insane, the amount of scrutiny that new mothers go through. I personally think, I'm not a mother yet. I do have one, though, you know. She had 5 kids, mashallah. But yeah, I think it's insane. Women need more support.
Right.
You know. Now, what kind of emotional or mental health challenges are common for women during pregnancy and the period after birth? And what is the scientific reason behind those challenges?
So women during a pregnancy and after delivering their baby or in the postpartum period, some of them, like around 50%, will go through baby blues, what we call it as baby blues. And around 10% might go through depression or postpartum depression. The difference between these two is that the baby blues happens, you know, at the beginning of the delivery. She will be tearful, restless, anxious, sleep deprived, kind of. But she wouldn't mind taking care of her baby. That's the baby blues. She only, you know, new mother wants or needs help. So that's the baby blues. When it comes to postpartum depression, almost the same signs, but it happens after 2 weeks, and it lasts more than that. And also, she doesn't feel she wants to take care of her baby, or she has thoughts of harming her baby. So this is the alarming sign that she needs help, and we need to, you know, escalate it, and we need to refer her to someone who can take care of her. So, as I said, around 1 in 7 women will go through postpartum depression, and around 50% will go through the baby blues. And why that happens? There are a lot of hormonal fluctuations and changes during a pregnancy and also after delivery. So mainly the 2 hormones are estrogen and progesterone. Then play a lot of factors and changing a lot of things, and the body and all the systems in the woman's body, the digestive, respiratory, everything basically. And so these hormones can play in the chemicals in the brain, and sometimes they can go through, you know, a hard time with mood swings, with emotional changes, and they have higher chances of going through baby blues and depression.
I think I read somewhere that in terms of like PMADs or postpartum, somewhere in the continent of Asia, around 75% of women go untreated. And why do you think that is?
Maybe some of them they are scared of asking for help or reaching out for help because of the social stigma, what people might think about me, like maybe I'm not good enough to take care of my baby or myself, or maybe they don't have the facilities to reach out and to ask for help and to help them to deal with it.
Can a mother's mental health during pregnancy impact her baby's physical health? And if so, how?
Yes, it absolutely can. Research shows that high level of anxiety and stress trigger high level of cortisol that can pass through the placenta and go to the baby and can affect the brain development of the baby, and also the placenta, baby birth weight, and even the long-term emotional health of the baby. So certainly it does affect the baby. So that's why we need to make sure that we are dealing with mothers who suffer from stress and anxiety as much as we can, to make sure that the baby does not get affected by it. Yeah.
Okay. Now, we were speaking about this off air, but if I'm a new mother, or I'm thinking of becoming a new mother, and I have predisposed, mental issues, say bipolar or depression, what happens if I give birth and then I hit that period of postpartum and I feel like I don't like my baby? This might be a controversial question, but it's a reality for many women. They feel like, I don't like my baby, I don't want to touch it, I don't want to be close to it, get it away from me. What do you do then?
Okay. So when we have someone who already diagnosed with a psychiatric issue like bipolar or others, we advise them to seek the doctor advice or go see the doctor before getting pregnant or before planning for a pregnancy, to make sure about the vitamins they should take, to make sure that the medications they are receiving are safe during a pregnancy or they have to change it, and just for further follow-ups and checkups before the pregnancy. Once she is pregnant, she will have a lot of follow-ups to make sure she is safe. She doesn't need, that we don't need to alter medications or increase the doses to make sure she is in a good well-being status. And after delivery, if we feel that she needs help or she doesn't want to see the baby or hold the baby, and we face a lot of cases like this in the hospital, what we do is we assign one of the nurses to be with the baby out of the room or in the nursery care for the baby, and assign another nurse to be with the mother, to be with her, for supervision, to make sure she's safe, she doesn't harm herself, until it's time that she is good enough and she is ready to bond with her baby.
All right. So there's a lot of support.
Yes, yeah.
Okay.
And we talked also about, would that hinder the bonding of the baby and the mother if that happens? And yes, it might, but we always have to balance the bonding versus the safety for the baby. So the priority is we need to make sure the baby is safe with his mother, and then the bonding can come once she is ready to welcome her baby and take care of him.
I think that's great to know. I think it's something very important for women to know, because like I said, it is a reality. It happens, and you've said you've seen many cases of it.
Right.
And it's important that women listening in right now know that there is support, there's going to be procedures, there's going to be ways, you're going to be taken care of.
Right. And that happened not only with a lady, because now I just remember the story of a lady who, with a similar scenario, but she did not have any mental problem or psychiatric problem. During the delivery, she was very tearful, and she said, once I deliver my baby, I don't want to see my baby, because at that time she was recently divorced, and she was emotionally overwhelmed and did not want to see the baby. So we give her that care as well. We give her the support. So we do that not necessarily with someone with a medical issue already, but we take into consideration all the social aspects as well.
That's amazing. That's really amazing. I love to hear it, honestly. So I understand that HMC recently launched a program focused on perinatal wellness. Can you tell us more about this initiative, and how does that kind of specialized support make a difference for mothers?
Hamad Medical Corporation Mental Health Service and Women Wellness and Research Center, they announced a transformative collaboration, and that is dedicated to enhance the perinatal mental health support for pregnant women. This initiative aims to ensure that mental health concerns are addressed promptly and effectively during a critical time in the mother's life. And in recognition of the World Health Day, that was on April 7, Hamad Medical Corporation Mental Health Service and Women Wellness and Research Center, they were committed to the global call for the maternal and newborn health and well-being. So they launched the campaign, and they titled the campaign Healthy Beginnings, Hopeful Futures, and that emphasized on the urgent need to prioritize the women long-term health and well-being. And when we refer to the perinatal period, it's during the time like from 20 weeks of the pregnancy until around 1 month after giving birth, when we say, because this is where most of the ladies have stressors and they feel overwhelmed. So what they do is that they have a lot of mental health screening during the prenatal visits, counseling, therapy sessions, and coordinated care between obstetricians, psychiatrists, psychotherapists, all as a MDT or a multidisciplinary team to help the women who need help.
That's amazing. That's really amazing. Now, if I wanted to reach out or join in on the program, how could I go about that?
So you can ask your doctor that you need help or you want further assessment. And when you visit your doctor, they'll place a referral in the system, and then they will reach out to you and then give you a follow-up with the psychiatrist and the psychotherapist.
I do want to ask you, why is early intervention so critical when it comes to maternal mental health? And how can women or families recognize when to seek help?
When we have an early intervention, we prevent small emotional struggles from becoming bigger and for the lady to struggle more resolving them. So early intervention better from the lady herself asking for help, or for the family member to recognize that she needs help and then they reach out and ask for help, just for her to be able to take care of herself, take care of her baby, because we always believe the mother is the heart or the foundation of her family. So if she is well and she is happy and healthy, then the rest of the family will be well and happy and healthy as well.
How do I know if I have a perinatal condition?
What do you mean?
Maybe they're trying to ask, what if they have, how do they know if they have a condition before they go into the perinatal stage?
If she has mental condition, like anxiety or depression or that?
I'm not sure. Maybe it's
like... Because perinatal is the time of the pregnancy. So what does she mean by perinatal condition?
Perhaps what if I have like a medical condition, or because we've already talked about mental, right? What if it's more physical, medical wise?
If it's medical or psychological as well, having regular follow-ups with the doctor, because every visit the doctor, you will have a chance to talk to the doctor and have a chance for the doctor to examine you and ask you questions, make sure you are healthy, and order some blood investigations and imaging to make sure that you are healthy and you don't need any other help, or if you have any other medical issue. So regular follow-ups, because there are some women, they tend to ignore, or for them, okay, I have 3 kids already or 4 kids already. She kind of know when to go to the doctor, and instead of following the regular follow-ups for the doctor, so she seems to skip some of the visits and only shows up for when she has a labor pain. And my advice is no, just don't compare any pregnancy, your pregnancy, to any of the previous pregnancies. Just have a regular follow-up and treat each pregnancy as so, and give it its attention and its time.
So what if they have depression before they go into the perinatal stage?
If they, as I said, during the follow-ups, there are going to be screening questions and screening method for depression. The doctor will ask a few questions to give a number and the scaling for the depression, the scale of depression she is in. And if they feel she is in the category where she needs help, they'll give her referral, and she will go see the psychiatrist and the psychotherapist.
Mother has a mental illness, and sometimes they wonder whether giving birth to them made it worse.
Okay, if she already was diagnosed with a mental condition, it can be because of the stressors of the delivery and a new baby and taking care of a baby and dedicating a lot of personal time to that baby. It can. That's why following up even after delivery is so important, to make sure she's having the proper dosage of medication, and also for if she's breastfeeding, there are certain medications contraindicated during the breastfeeding time, not only pregnancy. So it's good to have a regular follow-up even after delivery, to reach out and know she's taking the proper dosage and the proper medication. But that will be only for temporary time. Then after, proper counseling and proper management, she'll go back to her status if she is consistent with her medication.
Right. Yeah. But in the case that a mother doesn't, go for counseling and medication for their mental illness, and they just continue walking through life, as if nothing is wrong, that can obviously take a toll on their mental condition.
Yes, yeah. Because when we talk about stress, we don't just talk about the mental condition that they had before pregnancy. She'll go back to her life and she'll have, a lot of stressors. Some of them, they have financial stressors, social stressors, personal stressors, and on top they have a newborn or a baby, or if they have already medical conditions, that additive stressor on her. So, she can go through a lot of stressors after delivery, not just to the delivery itself per se, but to other aspects as well.
Mm-hmm. And could that also influence the child's well-being?
Yes. It can affect the baby once the baby is in utero or in his mother's womb. And also it can affect the baby afterward. Because I always believe a happy mother will lead to a happy baby. So if the mother is always, cranky, angry, and, in a low mood, shouting at her kids, the way her kids will look at her is like, this is the angry mother or the moody mother. They won't feel safe or easy to reach out for advice, for help, or for anything. There will be like a barrier or a wall between, their communication. It can hinder their communication, yes.
Right. Now, if I were a husband and I see that my wife, I knew my wife beforehand had a mental condition, and then, post-birth, let's say she doesn't go through the postpartum depression period. She was fine at that point. But as our child is growing, I see that her mental condition is worsening. How would you advise me, the husband, to reach out to my wife and suggest, seeing a doctor?
Let's start by saying having a mental condition is not something wrong, or not a bad label, or she won't be less than anyone else. Some women, they will feel, oh, I have mental condition and my husband accepted me but I'm less than others. So what I feel the husband can do is to support, and always reassure her that she's just like anyone else, and her mental condition is just like any other medical condition or physical problem that she has. So if in the future he noticed that she's going through, a phase or an active mental status, just to advise her to seek help, help her to see or acknowledge that she needs help, because once she realizes that she needs help, then she will follow and be coherent and adherent to the medication and the management. So support is my number one advice for those husbands.
And patience.
Yes. Yeah.
Patience
exactly.
is a very big thing.
Yeah.
Support and patience. Did perinatal mental illness always exist, or did it become more common these days because of these stressful lifestyles?
It can be, but not only for the stressful lifestyle. It's because of now women know that they can speak up and they will be heard as well. So maybe it existed before with the stressors they have currently, but now they're finding channels that they can speak up, so the number will be higher, or will be more obvious to others.
Yeah, I was gonna say, women back then just didn't speak up, right? Because if you had postpartum depression, for example, it used to be called hysteria. back in like the 50s or something, they would just, label you as hysteric and that's it, and then the whole town is like, she's crazy. She's hysteric. She got hysteria. She was diagnosed with hysteria, right? Or, depression back then was called melancholia, right? So, yeah, I just don't think women spoke up back then, which is why the numbers are so high now. Because, like you said, women are speaking up. They're seeking help, and, that's why it seems more common. How can people support their family members or friends that go through perinatal challenges?
If they realize that they are going through hard time or challenges, so it's important to be compassionate and to open up with them, and the most important, not to be judgmental. So just be a good listener. Let them vent out, talk, express themselves, and suggest what they need to be done. And if you feel that they are struggling with the baby, if she's a new mother, she doesn't know how to take care of the baby, just guide her. Or for some time tell her, okay, give me your baby, I'll take care of your baby, like go sleep for a few hours. So that
it
all
helps a lot.
Yes, yeah.
A little goes a long way.
Right.
Just even giving her time to sleep,
to shower,
to brush her teeth. Because like I said way earlier on in this conversation, sometimes we don't even brush our teeth. We don't brush our hair, let alone change our clothes and jump in the shower and wash. And you know what I'm saying? So giving her that time for herself can be like it can be a very big thing for her, right?
Yeah.
To you, it's like, oh, I'm just giving you some time to shower. To me, it's like, no, you're literally saving my life right now.
Yeah.
I stink.
And in the hospital, like I see a lot of, like if a citizen she will have a lot of family members, like here. But when residents, come and deliver, I'm very happy when I see their neighbors or their family friends or their colleagues at work come and help and support, because they know like their family are not in town. So that support, that circle that she is with, their love and support they give her, it will take her up from the depression that she's in. Yeah.
It takes a village. It really does take a village. So any support you can offer, I'm sure, will be so appreciated by the mother. Another question we have is, does postpartum depression continue throughout the mother's life, and does giving birth multiple times after that affect her negatively?
It doesn't last, not necessarily. If she's already diagnosed before the pregnancy with depression, she has a higher chance of going through postpartum depression. And when we label it as postpartum depression, it's during that time after delivery. But if, like some of them, there is percentage when like they might, go through depression, but majority, they don't. It's only during that time when they seek help, then it resolve, or they get over it.
All right. And what if, like, I'm a mother, I gave birth, I went through postpartum, and then I gave birth multiple times again after that. Yeah. Is it likely to come back?
It increases the risk of coming back or of having postpartum depression more. Like the chances would be more, but not necessarily it happens. So not every time, like if she had postpartum depression the first time, not necessarily she'll have it the second time. The risk is more than the first time, but not necessarily.
Not necessarily. What is the duration of postpartum? So you said it happens 2 weeks post-birth, and how long does it last?
Like around 1 month after the delivery. Some of them, if it lasts longer, then she needs more assessments and further management.
But is it like immediate after giving birth, the postpartum?
No, it takes around 2 weeks to develop or to feel that she needs help.
Right.
In comparison to the postpartum blues, when we say the baby blues, The baby blues, it happens, 2-3 days after delivering the baby, with the stress, the sleepless nights, and all of this. But as we said, that she still can take care of her baby. In comparison to postpartum depression. Postpartum depression happens, after 2 weeks and lasts more than 2 weeks. Yeah.
So it can last up until a month or longer.
Yes, yeah.
What is the husband's role in the delivery room? This is funny. We were talking about this off air.
Okay, yeah. As I was talking to you, now in Women Wellness and Research Center, we implemented a program called Patient-Centered Care, where any lady in obstetric or in gynecology, she can bring her husband or her sister, her mother, anyone that she can choose, to the clinic or to the labor room during delivery, or to the operating theater for the cesarean section, for the elective cesarean section. And the role is to increase the support and share the decision of the delivery. If, for example, she has medical issues, or if we have to interfere earlier, so we take the decision of the two, but mainly for the patient herself. The role of the husband in the labor room, well, ideally we want the husband to be supportive, sit beside his wife, hold her hand, remind her to breathe, and give her encouraging, words. You can do it. You're strong enough. One more push, or don't worry, I'm here. We'll see our baby. So ideally, this is what we want from the husband. However, there are some cases we'll see in the hospital when the husband interfere with the doctor's management or decision, just because he's overwhelmed, or he doesn't want to see his wife crying and in pain and going through a lot. They might some husbands might push us to go for cesarean section, which we don't advise if there is no medical indication, but it's because of their fear, or that they care a lot about their wives. So yeah, what we want them to do is be there, support us, support your wife, and just encourage them, because everyone is going through this process, but with a support of a partner, it means a lot to her, and believe it or not, it decreases the labor pain. Her perception of labor pain is less once she has support around her.
I want to say, although I'm not a mother, I feel like there's no such thing as this thought of what people will think of me for seeking external help. Like you said, if you can employ nurses, whatever help you can get from your family and whatever. I think we need to demolish this thought that I need to be super mom, because you forget you're human.
Right.
And that, that comes first. You're human, right? Before you take care of your baby's needs, you need to take care of your needs.
Right.
Whether that's food, taking a shower, taking a nap, or whatever. You need to take care of your needs before the baby's needs, right? Because you can't take care of the baby if you're not taken care of. So I would love to demolish this idea that we need to be superheroes as women in any aspect of our lives, whether it's motherhood or, daughterhood, being the best daughter we can be, or being the most exemplary employee in any case. I want to demolish this idea that we need to be superheroes, right? And we're human.
Yeah. In regard of listening to others and their criticism and what they say about you, just be selective of what you hear. Some people, they just like to comment on anything.
Right.
Your milk is not enough, you are not taking care of the baby, your baby doesn't look like you, why your baby is wearing like this, no, whatever. So just be selective. Know, there are certain advices will be important and will be, on point for you. Others not. Just listen, nod, say, okay, thank you. Don't argue, because if you argue, they'll keep nagging and commenting.
Right.
Just say, okay, thank you so much for your advice, and then you select what you want to take and what you want to reject.
What is your advice to pregnant women who are very conscious about their figure?
Okay, we have to be realistic. our body will change a lot during a pregnancy because of the hormones, because of the fluid load that would be extra on our body. So just being realistic that things will change, and it's going to be for a period of time, for the sake of having, new baby, taking care of, bringing or welcoming a new member of the family or a new baby. Things might change, but eventually, with good care, with a good plan, things can go back to normal. So just to prepare herself mentally that for a certain period of time, my body will change until after delivery, even a few months after delivery. But as long as I am healthy, my baby is healthy, this is what I should care about at the moment. Later, once, like after delivery, then she can, seek advice with a good diet and exercises postnatally. She can gain back her figure.
Mm-hmm. I think this is one thing that I worry about a lot. I'm already very conscious of how I look, right? Mm-hmm. And at one point in my life, I was well on my way to an eating disorder, mm-hmm. right? I ate quarter of a meal a day until I lost about 10 kilos. It was very unhealthy, but in my mind I was like, I look great, I look fantastic. Girl, you were not healthy. It was very concerning. Mm-hmm. And all my friends and family had a right to be concerned until one day I was like, it's not feasible to keep doing this. I can't eat a quarter of my food every day. And I decided to get healthy and stuff. But it's hard to fight those thoughts of self-consciousness and as much as I try not to care too much about what others think of my appearance, it's my own voice that affects me the most, right? Not what other people say. So maybe I'll look back at this clip and I'll be like, oh man, your double chin was coming out. And, and then I think about pregnancy and I'm like, I'm going to get big. And then that double chin is going to get big. And I've seen some videos of women who get pregnant and their nose doubles in size. Mm-hmm. And these are things that I'm like, damn, I'm terrified. But no, you're right. It's a cause of hormones and other things going on in the body. And
it's temporary for 9 months. And saying so about the body image, I don't want her to be on the other side as well. So knowing that, I'm pregnant, I'll already be big, so I can eat whatever I want. People will not comment because, I'm pregnant. If they tell me you gained weight, I tell them I'm pregnant. This also is not good for her and her baby, because if she starts eating whatever and chocolate and all of this, she will increase her risk of having diabetes and a pregnancy and gaining a lot of extra weight that can harm her and harm the baby, and it will give her a hard time for her to lose all these kilos after delivery.
Right, and that's why the word balance exists. Yeah. Right, it's something we learned as kids with the triangle food hierarchy. Balance is key. Mm-hmm. So I think that's a good way to look at it. Now, lastly, before we let you go and before we close up the show, what's the best way for someone to gently check in on a pregnant woman if they notice that she's not quite herself, maybe she's more anxious, withdrawn, or just emotionally off?
Reach out to her, give her time, listen more than you talk or advise, because some of them, they just want to vent and talk. And if one time they did not open up, another day they might open up. So I won't say nag, but be around, be available to them once they feel that, okay, some of them, if they tell you, do you have a minute? Just know that this is an alarming sign that they want to vent and they want to talk, and they need help.
Right.
So just around, be available to them, speak up, and if they need guidance, just lead them or show them the options that they have and let them decide on what they need to be accountable for their plan and their cure and their management.
All right. I know I said lastly, but this is my lastly. What message or what advice would you give to women who are, planning to become new mothers but are afraid of like stressors, or they're afraid of previous medical conditions. What advice would you give to them going into the perinatal stage of their life?
First, pregnancy is an amazing journey. So don't think about the possible things that can go wrong, rather than enjoying the journey with its ups and downs. Seek for help. If you already have a medical condition, see the doctor before planning the pregnancy to make sure you are on the right track, you have everything you need, and follow up with the doctor. Have regular follow-ups or checkups to make sure that you have all the need and you are on the right track. And the last advice is don't hesitate, don't feel you're alone, don't be ashamed of whatever condition you are going through. You are not alone. We are here to help you. We want to help you. So, and we are reaching our hands to support you. So just speak up and look for us, and we are around to help you to have a peaceful, amazing pregnancy. And have in mind, this is just a temporary thing. Mm-hmm. Like whatever you go through, nothing lasts in life. Just take its phase, give you a lesson in life, and then it will go away.
I love that. Thank you so much, Dr. Bothina Al-Mulla, for being here, for giving us some of your time. I know, like I said, we took away time from your patients. I hope that they understand this was a very good cause. It's very important that we get this message out there. And I love that throughout this conversation, you reminded a lot of the women who are tuned in that they're not alone. Help is there. There are so many ways to receive that help. There's so many ways to ask for that help. I think it's so important. So again, thank you so much. We really appreciate it, and it was truly an honor having you in the studio today.
Thank you, Juhara. Thank you, QBS Radio. It's an honor for me to be here, and I hope all the listeners that they enjoyed the show. And